with known history of hypertension is being evaluated in the emergency department for episode of severe retrosternal chest pain that began 4 hours ago. He is currently on ACE inhibitor as his only medication. On physical examination, the vital signs are normal. The patient appeared to be distressed from chest pain, but the rest of the physical examination is unremarkable. So in summary, he's 60-year-old with hypertension and has retrosternal chest pain that started 4 hours ago. Laboratory studies shows that serum troponin is pending, and here is the ECG. So if we zoom in, and your center is not PCI capable center, and the closest PCI capable center is located 3 hours away. Aspirin, clopidogrel, and heparin have been initiated. Which of the following is the most appropriate next step? So would you transfer him immediately to PCI capable center, calculate the TEMI score and decide management based on the results, begin place thrombolytic therapy with the rest of the medical therapy, and arrange urgent transfer for coronary angiography plus or minus PCI, or start thrombolytic therapy with medical therapy with no need for referral out afterwards, or just medical therapy with ECG and cardiac enzymes every 6 hours. So let's look at it. 60-year-old retrosternal chest pain, and this is his ECG, and we can see there is an obvious ST depression from V1, V2, and V3, and tall R wave. So this is a tricky ECG because ST depression in V1 to V3 with tall R wave in V1 to V3. As you can see here is more obvious, the tall R wave in V2 and V3. So this is posterior ST elevation MI. And actually, if you do an ECG V7 to V9, which is not standard ECG, you will place it in the left side of the scapula in the back. You will see ST elevation in V7 to V9, and actually this tall R wave is reciprocal to the Q wave. So this is a case of posterior ST elevation MI. Would you transfer him immediately to PCI capable center? This would be the correct answer, but your center is not PCI capable center, and the closest one is 3 hours away. So this is too long and will cause a lot of cardiac damage, so this will be incorrect answer. If the PCI capable center was less than 90 minutes, then that would be the correct answer. So this is incorrect. Calculate TEMI score. TEMI score is mainly used for unstable angina and non-STEMI. So this is incorrect. Would begin ticaplase, which is thrombolytic therapy with the rest of medical therapy, and arrange for urgent transfer for coronary angiography plus or minus PCI. This would be the correct answer. Would begin fibrolytic therapy with medical therapy alone. This would be incorrect because regardless if you give thrombolytic therapy, if it's successful or unsuccessful, you need coronary angiography and possible PCI. Obviously, if it's unsuccessful or no reperfusion, then you need PCI directly. Medical therapy alone is incorrect in ST elevation MI. So the answer would be C. Okay, so here is the correct answer, and here is the explanation. This is a case of posterior ST segment elevation. Posterior MI producing ST elevation and Q wave in the posterior leads V7 to V9. Like I said, if you place an ECG in V7 to V9, which is in the back where the left scapula is, you will find ST elevation, which appears on the standard 12-lead ECG as a reciprocal ST depression with tall R wave in V1 to V3, as we can see in this ECG with tall R wave. So in practice, posterior MI is diagnosed with tall R wave coupled with ST depression in V1 to V3. And the management of posterior MI follows the same guideline as any case of STEMI. So all patients who have received successful reperfusion with thrombolytic therapy should be transferred for coronary angiography plus or minus PCI within 3 hours to 24 hours. And in case failed, obviously, an immediate PCI is indicated. So we talked about it, that answer A, which transfer immediately to PCI capable center, is incorrect because it is 3 hours away. And reperfusion is crucial, and there is no room for delay because that will lead to more extensive cardiac damage. So PCI is indicated only for your capable center, or it can be referred within 90 to 120 minutes. Even less is ideal. So the TIMI score in unstable angina and non-STEMI can be has a role in practice in calculating 30 days mortality in STEMI, but is irrelevant in this case. And answer D is give thrombolytic therapy with no referral afterward, and like we just said, that all cases following thrombolytic therapy should be referred for coronary angiography plus or minus PCI if it's successful, and if it's unsuccessful, PCI, rescue PCI or PCI must be performed immediately. And medical therapy alone is incorrect and not sufficient alone for reperfusion. So reperfusion method is mandatory in case of STEMI, whether with PCI or thrombolytic therapy. So learning objective, that acute posterior MI is diagnosed with tall R wave and ST depression and leads V1 to V3 and is managed the same way as any case of STEMI.